the arthrokinematic restoration system for the elbow joint. The elbow joint is composed of both the humeroulnar joint as well as the proximal ulnar radial joint. And we're going to look at the repetitive movements that we commonly do. So we usually, when we are working or doing activities, computer work, moving in our walking position, we are pronating our forearm and we are bending or flexing the elbow. That is going to be a concave ulna moving on a convex humerus. So we've got an anterior roll and an anterior glide when we bend the elbow. And then when we pronate, we are going to have the radial head, which is going to be a convex surface moving on a concave ulna, and that is going to be an anterior roll and a posterior glide. So we've got an anterior glide we want to restore with the humeroulnar joint and a posterior glide with the proximal radioulnar joint. So there's two muscles we're going to release with that. We're going to release the triceps and for the elbow, the humeroulnar joint, and then we're going to release the pronator teres to restore the posterior glide of the radioulnar joint. So the first release is the tricep. I'm going to use either a lacrosse ball or a double lacrosse ball. And you want to be on a firm surface. The countertop works well. I'm going to take my the back of my upper arm and I'm going to bring it about shoulder height. I'm a little bit higher on here, but I want to apply pressure onto the tricep and then just slowly work my way down all the way to the olecranon or the elbow. And this is going to be on the long head of the tricep. I can then angle and work all the different areas along that muscle belly. A hard surface, and you want to stabilize and mobilize just along the tricep region, spending 2 minutes to release that tension there. So this is just the release for the tricep. Then when I go to release my pronator teres, I'm going to come right to the inside, so that medial epicondyle on the humerus, and I'm going to come down and then over just a little bit, and I will feel a kind of strap-like muscle going at a diagonal over onto the radius. So I'm going to apply pressure to that muscle and just hold that and work on releasing the tension in that particular muscle. That's my pronator teres. It's going to pronate the arm, which is going to be that anterior roll and posterior glide of the radius on the ulna. So release that muscle there. After I've released the tricep and then release the tension on the pronator teres, then I'm going to stretch those muscles. To stretch the tricep, I'm going to bring my arm straight back, take my elbow and push it backwards. I can bring it across, but I'm looking at getting the stretch right through here. So that's going to be my tricep stretch, holding for a minute. After I stretch the tricep, I'm going to stretch my pronator teres. To do that, I'm going to take my other arm and I'm going to stretch my forearm into supination as I extend my arm. And I can do a moving stretch where I bend and straighten, but I just want to hold the arm in supination with the elbow extended, holding that for a minute. That's going to be the completion of the stretching. Then I want to strengthen to encourage the glide. So I'm going to strengthen my bicep. I want to keep my back straight, my spine up against the wall, so that I am stabilizing my shoulder blades as well. And I want to not rock, but just bend from the elbow and repeat doing 3 sets of 12, 3 sets of 10. You want to do 80%, 1 repetition max if you're looking for strength gains, but you're just looking to do above what you are used to so that you can re-educate the muscle and improve the strength in order to assist the glide restoration of that. And that also is going to be held in a supinated position. So we're going to also encourage the posterior glide of the radial head for that pronation. And that is the arthrokinematic restoration for the elbow.